I think we are just out of time for the question and answer session, and now we are going to move forward with the second speaker. Kaminangi Niwalia Duanyi, Dr. Kalsang Choedhan.
Tsangwal Trashti share the chapter that Taringi Joshi and the Chilugi thing, the allopathic menta and the Sujin Sorabegi, Nishikol Toling Chedre. And the Ringi Tajushi, so Chidangi, Poe Nishida, Chidak, Poegi, Cancer Colia, Tsikaji Shugi. According to Tibetan medical system, stomach is considered one of the most important organ in our body. So it is like a utensil or pan to cook and fry foods in our body. Tanga jegi missionalia tab de shuish soyere ta pola dia ketchup shuish ta ngazo tyonga neutral nalonia po dia ta ketchup shuish segore ta tab de uchi pe khari shayar sungsuna junalia po yuju shebe konga dasna soyere tila di sambala utensil the pan se de khari sungor sanaya ta khala sudi sambalia ngazo frying pan kugora ta frying pan ti yaku chuyosuna khala yaku choya da khala de masiya de laga cheto gore. This on the Digaski, Pesha, for the Kalaswell, Pen, Shinchiki, Kachimbuchago, restaurant. And the Ganashita, Kisi, Miss Osolia, Poa Chajum Mangush, the mid top chair of the Poa chair Yongore, Mia She Chung of the Poa is Chunga Yongora. They should do some Palia, so Pola Pawe Kalati, Tata Sagore. That is it, Poa Chunjung, much Mesona, Yakala Shimbu Capsule Pena, Momodine Capsule, Yakala Shoe, says on a Yak, Jumatoche. Sujala, so what another Gabrijala, so what the Nekangi Tegore. The patient Nuje do Chasha, Sona, Celan Chunjun Chileanzi, Tse Manguch Luce, Taya, the Nuela, so what the Chilsona got Celania, Luyumura. The Chicojan Poach and Julia, Kalamagush, Sasona, Yako, Chogo, Matakantaria, Kenya, together, or another, and it's a Tango Sile, the Degi, Gangi Shunguda. This was also Paula Pave, Kalasa, the Cajun Shuj restaurant. And this sugar Carson Warsona, the poor the Kachulu. The kitchen would sungora, the poor the portion said of major songs, Shinsada major sauce and swingera. It is also said that stomach is important like a soil to grow crops. The Dikarson Gorsanaya, Tundo Yagu Yachilaya, the Sashin Yaguch Kogora, Sashin de la Chuda, Luda Mangush Yaguch Kogore, that is Sashin the said the Demba Shuna, Tundo Koyagura, the Yabajura, this was a Kisi poor the Yaguch Yosuna, and Naza Manguchi Yango Chiada, Naza Manguchi Managi came in Shuchores, and that poor the Kachimbo the Korsungoere. The Peshana and the Pebegi Mishunalia, Nelanga or Mashua, Nansonere, the Nazanania, Tang Tango Karichun and Mashua, and the indigestion Lajura, the Toma Chuneres, that indigestion La Chua King and Jelly and Nazar River Nazamangushke or Sungore. That is Samala, poor the Kachimbo Shui, but the poor Major Soga, the poor the Tola Mandroaji, Namjin, the preserved sugar, the Kachimbo Sungore. The Dinalia, the Poagi, Jiongi, Neshigi, Kenchura, Jugan Karimeda, Chedagbata, and the Poegi, Pote Cancer, Latigi, Jugan Karim Gorsana, the Poagi Naza Shukche, Karim Gorsanata, Sachet about Sambalia, Kala Ori Chiajura, Tangazo Momo, the Shavalila, so when Shimbu Sambalaya, Togo Kana is Sashoda, the Maimba Chera, or it in Sawan Machache, the Togo, Rodando Chesona, Poa Jaja, do you don't ask to Chikansnani? Some shout in a pay away on Sade. You sang us to Stomba Shacherala, Petcor full Masache. And it poor Nishichik, Taxi Satania, poor Metro Yamche, and Jane La Soba in the poor Nalolia, Nazadamara Unache. And Yeba Tandata, physical and mental stress that is Sambala, Semba Nalo Kangache, Lubona Localeta, Nimachina Chuju, Juni, that Jongas and the Lagachi, and Kaladi to do Saya Maravada, Taganashini La Soba to do Tadash Niematosuna, taking up Poagi, Nazak Juice Chadore. Tagana Jitang of Pedo Chashuna, Namshi Tangmod, Shazin Lumba Dela, Dendelia, Mixegi, Poa, Chobuchagi, Yangashu Chagora. This was a Nam Tandu Sambalia, Kala the Misegi to Nanchigo, that is on the Kala Tabusala Soba than the Chagwari, the Tanguri, the test chicks and Chituna Yagore. And it Sumba Tachi Karisha food intolerance, like Mazo Mutabe say like Jorana. Kabri Mikashela, Omaton Lapsan Togo share the Ola Soba than the Kashi Chiki. Said in the southern of Togo, Bugu said the Yungudola, that's Metabe Serra. They get the engine Nega Pango or Kisiko Tragmesona, Yamado, Kisi Tragmesona, Matuache, Nimakashi, Dundakashi, Tawakashi, and Kalikali Panche, Yan Jelly and Rebellion to combustion decore. Either any chick to the Karicha was that choose the sang on Zogia, preserve food, Nalolia, the canned food, Mangujura, Dwarina, dinalolia ta zejo mango shu cha de re ta zejo dige ni ya khali khoba nalolia sa che dige lungi kenchi ji dri che ya train cha che cancer cha la soba de ta pho nal ulcer cha la soba de ta gastritis ta de naza mango shu chung go re ta anda pebe me shu na la khari son versana ya khase mami pale ten le ani te nyandra ge yong go re song go ta nyandra la di sam nga zo tra ya bu ta duja lan di sam mai ba ta nyandra la di sam bal kho chu chung bu shu jo re adi ka su ya phore ka su le nyandra la de kharu ko go versana ya ta tendu ke shadan shuwe na tanda ta cells tige nalol abnormal growth cha cancer cells ke yongor se jora dil ta da photo gore se ge ta toxin dinde la ya sedu da dinde kengi ya khala ning ba dinde la phowe do di kengi ya phowa nalol cha gi chale dige thuk che laga che ta da ma che che ani nembu sa ba ke la so ba da cancer cell la ke la so ba de chen ya ni na de ken de che jungen de che yongor es chama che 다 먼저 미슈나리아 지나 단다 gastric problem 데 포에게 다 나자 예와도 차시다 나자 만라 다직카 주루도 송에레 다 디나니야 주루게 차웨 겐게 포와 나야 다메 겐게 포와 나와다 다 포와 알서라 소버네 수리알라 당 치슨다 알서 라이처라 베베게 미슈나리아 다 로니톤 하스네 미슈나라 송차브레 다 알서 단 수리아스라디 안다 포에네 실 알서 다 직과 차고레 다가나시 폴롱다 아니 다 나로리아 마주와 마슈와 나자다 망고체레 다 주로 나니 믹스에기야 포테스에 줘라 포테라 데 드네스라 데 포아 캔서 로 송고레 다 포아 캔서 데 포네 주로 나니 직송여레 안 지다니 맞제기 메슈나리아 제세야 데 드네 데 랭게니 직제고레 다 랭게 수디 사발라 주디 케디 삼발야 포고 추주 케디 삼발라 주디 나로 여버지 송고레 다 땡두기 책다 자르스나 페젠 제네틱 디스오더스 해 줘라 디 다다 되게 메로 상부도 다 제네틱 디스오더 라디 삼발라 케시 소소게 지인스 나로 여서나 안 포고 제바니 춤부 차디 삼 나자디 나에게 보고 셴바다 미셴바라 제스나 나에게 냥가다 체아도 시기도아 그정도 제네틱 다다 총고 있어래 땅 저기 보디 캔서 데 계세 파마니가 라 캔서 나뇽에나 대상 치료 엘로페디게 니가 계세 나뇽나 보고들라 나에게 냥가 체아이레스나 송고도아 데다 공주 더버더 저래시다 데 먼저 메숑데 달로 돈다 니도 파스 두고래 디체 아니 단다 보레체 지단에 단다 메숑나라 다가나 송이래 포하게 the train the mangcha going or it often occurs in the junction of esophagus and stomach and small intestine duodenum se jora ta anda pemena la dagara sung do na anda chida phowa ge train che mangcha jik thanda phowa chilupe esophageal cancer se jora na ta thanda mikpa ge zozam che phowa ge go jora la thanda the lower esophageal sphincter se de la train the mango shu chung do na ta phowa mangcha ro de yong de re an niba de word le duodenum se de thanda phowa ge jog che jume ge go jora la duodenum 대라게 캔서 망고 차되겠다. 지당 안저기 베베 지도 나로리아 포 캔서 나게 망고 슈 중고래. 안 다가니 침바 캔서게 빼 망고 연구도 하나. 다디 세제다 남시다 간지 토는 투쇼도 ken게 되네 용데 거래 단다 미슈나 소원하시 코 랭게레스 제네틱 디시스 레소도 삼발라 되게 페젠 자와스 차게 요사래. 더 지인스 나라 유두 삼발야 미리 심바타 도와도 차샤스나야 도와라 캔서 나자 여르데 이네 베베기 민보나 신치기 포화 캔서 나게 할람 통화입니다. 빼 당바 뉴뉴로 도알다 더바다 차샤나. 그래서 삼발라 진스 다 텐데 책 대화에서 다 페메나 다가시 송샤. 맞다. 제맛. 아니 다 되게 다 포화치기 다도지 가려서나야 loss of appetite 라다 칼라사니 마디오체 indigestion 칼라테 사우드야 마주오체 포화 베도라 소바드네 에데요야체 and fullness after eating so this about khalate sasa da dang there the shoge shoja choose gebas say na ge gonda choose shiba ngaba dola thogo ma to che khang denge de thona jungu da di phoa na lo liya khali khali nyam do ge be tash den gore da na shi discomfort in abdomen phoa ge to na na su ta la so ba den da shime ge la so ba den de ge ta zin shung gore da na shi train se this sambala tanda train de khandi yong gore na jidan phoa ge train de ngazo cholo ni thong thu ya yamare the train the kana kansan sak chumbu chadi sambala ta third stage the fourth stage the sambala ya lagwe dus cholon reg the sambala reg thuya trapu che stable the sambala ta nimbu do jinga chana ngam se chawon dus the sambala pha zo yo thogu da the cancer ge train the karsan yo thog mar ko dixing gi ju mana che trapu shu che an ko kuju jag mare dende ji ta zen chores an thamadla thanda me shuna da garan so yere ta phore thamadliya me be kapsuliya khari warsana ya ani train the ma dwe che an 차트 코바나로리아 카사 조반님도 마 차셔라 소바다나 신야 켄도야 아니 저거지 차셔라 근데게 다진 용어를 했어요라 아니 디 제마디 앞에서나 다디 땡두기 파리 다 포하기 땡쳐도 마 디사마 카이스나 포하기 니세그라 라이닝 나로리아 포하기 나로리아 땡도도 망고 쇼시게 되래 다 다 trained 게체 trained 다 fourth stage last stage 도 좀 가르쳐 버스나 trained 되체 아니 마차 마사도야 된다 걔는 쪽이야 되는 용도도 왔다 미션하라 베메기 sorry 미션하라 다가랑 손이래 그 trained 미운도 삼발이야 예만나 예샤물마 쪽반이도 마차 되는데 예만나 야 걔도야 쪽고 쪽치는데게 내가 연구해서 남 손이래 다 도디도 싫어나 대선자다 포아디 남준이야다 디상아조 다다 가이스나 칠로기 따제 체를 받대 체페 통보를 하려고 야고래 다 소래고 참 많이 봐지 냠도 송래 제제라라다 따제 체 엔도스코피 치고거나 엑스레이 야고거나 믹스에게 로 납주 신차와다야 엔도스코피 진지미지 체토나 야고래 상부도 되나니 믹스에게 남준이 포아 조야 깔에 eng에든다 보여야다 된대요나 따제 녀봐도 최고로 했어야 도지나
Thank you very much, Dr. Kyasang. So I'm sure that majority of you have known, but for the few, I'm going to briefly translate what Dr. Kyasang said. Basically, he talked about some of the problems related to stomach. We call it gastric, and the importance of behaviors, importance of the eating the right food, and there are a number of different foods that has to be adapted. For example, for some conditions, eating or drinking something very cold may not be suitable. So likewise, Dr. Kyasang also talked about some of the malignancies or some of the cancers that could happen, and also on some of the ulcers and problem. So in this relation, I have a question for Dr. Kyasang. It's a very broad question that I have. When I was practicing medicine in Delek Hospital, I used to have a lot of patients with gastric problems. I used to have a number of patients who are both taking Tibetan medicine as well as Western medicine at the same time. So initially, I got a little confused as to how this might, but then I saw that over time, patients were not having much of a problem, and they were both taking the medicines, and both the systems of medicine seemed to be able to bring out their effect without much of a problem. So it is beyond doubt for me that there are some of the Tibetan medicines are really beneficial for some of the conditions. And to quickly recount a story, we had a dentist from Mumbai at Delek Hospital in India. Actually, she came to volunteer her service to Delek Hospital, to the Tibetan community, because she had a problem. She had a chronic disease that really did not got taken care of by Western medicine. And then she went to a Tibetan doctor, and the Tibetan doctor got rid of that problem from her. And then she wanted to show her gratitude, and to pay her gratitude, she came to Delek Hospital to volunteer for 6 months. I'm not going to say her name, but there are a number of instances where the benefit of Tibetan medicine is beyond question. And in this regard, I have a thought we were always curious as to how you make diagnosis in Tibetan medicine. I saw that Tibetan medicine has a very special way of checking the pulse. Can you please enlighten us about some of the ways that you make a diagnosis, please?
지당 타당 저 베베게 냉에 진다라야 딸의 최송스라네 소미열에 저기 미기 따니 초로리아 내다 가리 통고도 저기 파고도 간데도 트렌도 데 간데도 다야 저기체 안 티와라디 삼발에 다디 개침부 쇼이세고래 네발이야 내다 티치 인터로게이션 세저라나 간데 나기도 나니 가져도서 칼라 가리 사임베 딩엘라 니 가져 녜베라 다 티와테디 딸의 가사 인터로게이션 제어라나 다 라스 레코들 가르쳐 버서는 아주 자주 다야 줘라 통화디 찍찍 통화디 가르쳐나 다 추다야 줘라 진바 나로리아 안저게 롱다 티바 베게나 따조 네바 숨셰레 디나네 케시 따지게 포와 네바기 미주여서나 포 나자기 깬 가르도 거다 준제 트야지 거 롱기 깬치도 티베 깬치도 베겐 깬치도 디다야디 개침부 쇼이세고레 다디 당고 코란 소소 따디 삼발라 미디 따디 롱기 따도 제와체 진바나 따디 삼발라 줌바다 보아 춤보도체 다 인데게 롱기 네다데 여바체 딱 칼라 간잠 찍자제 둔조스토 지 할람 찍다 하고 토거레 디갈레야 다 타마들이야 짜다체 단다 짜다니야 짜낭로리야 롱지 베겐기 짜기야 나자 소소소 시다 먹고 셰레 롱고 짜이나 파르당 카가치 티베 짜이나 파르당 카가치 되게 이 차단 때는 돔 저도 sample 안 나도 다데 패션나 계속 코 포화 나거든나 간저게 메슈나라 가르스나야 밑니리야 니가 포화 나게 열때 에네 카가 용거래 가이스나 저다 니가 포화 나고 얼때 소자고 얼때 찍라 롱기 깽게 소자 인세버라 찍이든 티베 깽게 소장에 용거래 다 계속 롱기 깽게 소장에 칠래야 티베 메 타소나 코 뇌마 지게 팽 가보라 대선자야 미소소소리야 지게 롱지 팽에 소나 카가 용거래 대선자 베멜이야 나자 찍라 메직 사원이니 와야 말해 다 치스 패션 알로패틱도 차스나 계속 애시디디 용거는 엔터시드 살아체 지용도 차드다 다 애시디디 가르기 용거도 콜레 롱기 슈크체야도 티베 슈크체야도 딜 할람 따지 칼라오래 다 다일로세스 케면도나 당아주 계속 야 티베 셰청부 중가치나야 딜이야 티베드 마 까야기 다 탑람도 가르치도 디 사노 슈크청부 당고래 매참 많이 받체 한 되게 간다래 따짜다 추다 지와다 되게 차상 덤잡치야 아니 포화나자 따체 코 롱게 계속 코 포화 롱에나 롱디 다 롱기 깽체지야 콜라 포화 게스틱드니 차고도 아니 계속야 가사 롱라 마니웨 칼라 카레다 젬바사야로 속바든다 장무사야로 속바든데 마사스는 까고 거래 그래서 내지 소소라 빠치야 따제체지 아니 맨도 스테고레 수야이나
Thank you very much, Dr. Kesala. So Dr. Kesala briefly educated us about how Tibetan medicine makes a diagnosis. So important thing is you look at the symptoms as in any other system, get a detailed history, like if there is any yellowing of the eyes or body, and then following that, in the Tibetan medicine, there are three important concepts, which is called three humors of the body, lung, tiba, and pegin. So when there is a disturbance in these three humors of the body, then that disturbance leads to illness, if I'm not wrong. Is that how it is? And then in Tibetan medicine, there is never a particular medicine for a particular disease. You see a patient as a whole and then try to understand the system, and then which of the disturbance in these three systems is causing the disease, whether it is caused by a disturbance in lung or tiba or pegin, and based on that, then you prescribe medication. So that's actually really illuminating for us. And then also he mentioned about the importance of checking the pulse and urine to make a diagnosis in Tibetan medicine. So after this, may I direct to Dr. Namdul about gastric problem is a highly prevalent disease in the Tibetan community. I'm sure that you have worked a lot in, regarding this. I'm curious as to what you have to say on it.
Tushna, I think for all of us, one thing that we are aware of, or we kind of use that among our own conversation when we're talking about one of the most common illnesses in our Tibetan community is something to do with POA, right? Gastric issues. And it has almost become a synonymous with our Tibetan community. 다르게 모신 바까지 또 상매 다랑 포화디 간데스 용거래. 아주 배배지도는 포화디 주 용거듯. 딜랑 아란주기 시에디 총이 돈이 시에도 삼고 들어와라. 이 당이 건도시원을 시에 단다 치루다 땡두기 스메 메다 아란주기 단다 수기기 소르고 이니기 냠루 돈이 개침부지 가래도 쉬워러지나 단당아라주 배배나 포함내시 망부지 요도데 나 배배 암지 망부지기 면주나 되기요래 망부지를 팽기요래 이네 망부지를 마피와 용기요 그러라 so the indusum but chisu tajina indusum but the nebu pechagrishna as pylori like manguchil thengiyore. And it's one of the most common parasitical infection that people are observing in Tibetan community. Manju pevana shuma thengiyore. So the indusum but nebu diyo the ngwe zimbarajina any pevamji ki menjuna indusum but nebu didudas the dila when chilugi swime antibiotic tan now me swime khande tan now rashni dila pende yagoche the nebu di yagochini jig ngwe zita menjuna to rajina dine pime tan indusum but yagoshira pingi dosnani didi ngarazu gyundu ngarazu gongba shego isto. So in that sense it really works well when you have a specific treatment for a particular gastric ulcerative issue or it's just a gastritis issue. So if there's a particular antibiotic course that we can give that works really well, not only in controlling that illnesses or particular health issue, but you can actually take it out of your body system. And then you can follow that up with a specific course of Tibetan medical treatment, and that really works well. So I think there's one thing which really, I think over the course of time, even back in India when we were working together, we would talk about that, and certain things now it's coming up. There are few studies, chilugi nyamshi manguch na yore, and they are really seeing lots and lots of Tibetans being diagnosed with having that positive parasites or bacteria in their system, and that's one thing which we really need to talk among us, because there's so many times Tibetan doctors would keep on treating them without really realizing what's really the core issue in there. And so
thank you very much, Dr. Namdul. So Dr. Namdul actually stressed on the importance of this parasite, H. pylori, Helicobacter pylori, which is actually causing a lot of the problem of this gastric problem that we are facing. So I'm actually curious as to what Dr. Thupten has to say about, especially you have worked a lot in the Tibetan community, especially in the monastery, in a huge monastery in South India. You must be seeing a lot of patients who are having POA, and a number of them may be H. pylori positive also. What was your experience on that?
endoscopy poet now target ni cheunde mang chewaji ani H. pylori lan nebu jora diking ani poet ni shi ni yungu ani dinde yungu anga antibiotic lan meje dindani antibiotic ta teacher ani poet ni dinda shi ni ta inde tage halewa yabu ni yungu ani de yamro che de nyamno gari chungu lana anga neba du de ha go ke jumuresa H. pylori la nebu di khani yungu res ngaji naishi nebu jora andi khane yungu lana ta ma ja da andi khala chobu da chu chobu ne khala da chu chobu ni yungu yore de ja ngaji neba zo seshe ni che yungu ani ta thanda meju jin thagire das ina ai maum bala kese kya de ya khala chobu da chu chobu dinde chewara jina enjo kya de nebu dille ya kya da pho ni shi ni yungu res dile 강아지 레샤 포에네 시직 디네로지 레샤 칼라다 저와시 좀도 아주 칼라지 뒤에 딱딱하다 마사야 바다 아니 지 칼라나는 지 매너지 숙중부 용의 게 아니지 포알의 규요 애시드 근데 마로 드라이킹이야 포에네 시딘데 중간에 망고시 그 남녀들이 총선시
Thank you, Dr. Thupten. So Dr. Thupten said there is a very effective antibiotic therapy for this bacteria, and also he mentioned that this bacteria may come from water and vegetables and things. So it is something that the discussion will unfold. And then also I'm curious. I would like to ask Dr. Estila from an infectious disease perspective as to how this bacteria can lead to cancer. If you can briefly talk about that.
The Helicobacter pylori says the nebudi chita the sumudore poanishi chita the ulcer says ulcer any kisi the ulcer yovina endoscopy should digi shut the score biopsy check. 아니 किसी also 여ben이야 cancer redomin도 인지미스다 war 그때 아니 냠도 지나 H. pylori 랑 임베나야 직 칼로레 랑버기 딱제 체네레 탁 딱제 체네레 쪽버기 딱제 체제 문제인 치다던데 요래 다고 가시오레 cancer 컨디스 샤고르 세베나야 직 칼로레 다 irritation 라는 디그와 inflammation 다 irritation 체제 다 콜라 사브라마 오 랑랑랑랑 제제 아니 콜 도시제 교인칭제 된 차교도 이제 마시선 근데 마시 십대 컨데라 슈거나 상무도 근데 디 근데 나즈디 베베치존나라 요버디 다 계속 같은 버 나에 대민주 진용다 나라이 내부디 요이니마 민주 진용 등산간이 가르쳐 왔으나 디 등산 등단이 메타이디 교험 지구열 때 디게 마펜백이 제 resistance 라체 된데게 등산야 강이 쳐 ru ta sun za de ya ma ba phemen da de thon ne chik men ju da de nye be na ya lam chimbu ju ri sang da
아니 디슈트나 삼서라 지다 단단한 저기 베베메슈나리아 맨다 추계 통사야 지 단족의 망고 퇴뇨의 제메 마초게 다디 주제 개체부 쇼이 차워 카이스나야 다 단다 건디 쇼나 시야 네랑가 마쇼와스 나잔안 당쇼 마쇼와티 하고레스 데네네 멜랑가 추계 송고레 다 맨안에 당쇼디야 추계디 다 맨나시 개체부 제거레 주제 카이스나라 당한주 쇼게야 란사와디야 또동갑소 브레이크파스트 다 쇼자마동연이야 추사부 통라디 가르기레사스나 The design peshashana tandang jogi gas and the petrol the gelia yaw mangusta regular the premium laden nanglo detergent yore the engine nanglo the shagdi the pachangma sogol the je shese sto the dida chigwa jang khaisan namju ng jogi po nanglo ya shagdi da shada jukhago the mangush sagor de tako changma suya la ya 가르고 거스나 추사보디 통토에나 추사보디게 shagdi 마 다야다 po meje keada po digestion yoelya pemes pen thogore This was a choke, Nimachiglia, Yongshola, Cup Kankang or Shoja, Machung doing the package on Borisha. Chitani, Nazuki, Pebegi, Chuzonalia, Poene, Shita, Mixegi, Poegi, Jason, Arkansas, and Adimango Chungore. Chitani Chick D inside a Sejoga Tonia, Nazu Peba, Manchar, Tajani Shagabore, the Shungezo test, Nimatsin test, Yunga Serte, Manchar, Shagabo, Digalani, Shazi Gaborola, Chadoja, Tongore, and Pashala Sobachazan Sadu Sambalea. The Shala, the Jukabo chair, Co Shaziri, do somebody a pawn or lay a tapsi shoes chagore. Taco Kali Kalia, Nimataba Shasha, Sadu Sambalia, Jumato, Jango Kali Kali Jobro Chache, and HG, and Paul George and Alol Mado Cha, Kali Kali Kenchia, and it Naza Dela Soba than Mangush Cha and Godona. This was a year, and it long up to some of the Taji chair, the package in Borosha, Chilu Taji chair, and surely Kisi Poa, Kineshit the K Menage, Papime Chashana May. Shoge Sindunga Bala Sobatende, Sindu Tanela Sobatende, and the Tantan Paya water, Becky Benchumbora, Kaisana ya poor Medre Soyada, Kesi Nalolia, Naza Changi Ching into Chiledo Chis and a Mendigaya, Pendo Chubushu Yongo Resui.
Yeah, so Dr. Kesala further stressed on the importance of, because drinking hot water is a common tradition in Tibetan culture. We all do, we drink a lot of hot water, and when I was practicing, I have been told by one of the Tibetan practitioners that the first medicine was the hot water that was there. So Dr. Kesala also further stressed that drinking hot water, especially after a high-fat diet, would probably help in enhancing the digestion and also washing out some of the harmful substances that are there. And also, without doubt, in Tibet as well, a lot of people are not able to gain access to Western medicine, and a lot of people are also receiving Tibetan medicine as a first. They're having access to Tibetan practitioner as their first system to go to. So the importance of it is definitely. It cannot be understated. So with that, I'm wondering if there is any other panelist. I'm wondering if Dr. Liu, what you may have thoughts on H. pylori in the pediatric population in the U.S., or what do you think about this disease in India, in the Tibetan population in India, because it is a highly prevalent infection in the community.
It is highly prevalent, and stomach ailments were also, in general, were highly prevalent in the work that I did in the Tibetan settlement in Mungad. One of the questions is resources to be able to diagnose the H. pylori and also to treat it, because it does involve a little more prolonged than usual course of antibiotics, which can have side effects. So you want to know that it's there before you treat it. And there are test kits available, but they do have some cost, which on a large scale can be prohibited. I was also curious as to how much research you're aware of that's been done in terms of the effects of different diets on the stomach diseases?
anda doctor log soya de ya da poi ne shi tole ya pime thon ya anda nyamshi de ke che tole che resin de ende che song song da chidan de ya tanda mezikan da tanda warnasi da dwala ya poi ne shi kole ya nyamshi chida che shin bare da dinan ya ta chigda do je tanda nyamshi chi de sambale ya zo ge tanda ta gomba kha do nyamshi chi de sambale shuk che je karu thong go resna ya ta sejo thon ya ta tende che ya nushu duge de sewa shore sha 다 지단 이망한다 세라도가 로니스 라가 체뇨 고바카나리아 다 자와 마차 포하기 내시페 망고 용도 준제지 가르에서나 콘조 다 셸라드나래야 다 자바 티직 다 배정가동 조던들의 뒤직래 칼라스에 고도 삼발이야 달리드 조부 쳐야라 소라로야라 소바드는다 발레드 조부 쳐야라 베깅 파르드로 쇼춤부 쇼슈로도 하나 되게 다 즉세기 ken치야 포하니시 망고 쇼슈 용되기도 지단 아란도 차셔나 니마다 세라라 내가 제일 값소야 닝고 셸라데다 곰바네 대나한테 거래 다 지난 밖에 레니야 다원이 쇼리야 포디 마데 상상 베딩에도 인데 중요한데 들어나 되네니 다 내가 가서 로직라 다와지레 컨센처레 컨센 값들이야 포디 세상상 다르고도 제일 상모단데서 봐 가이드 삼발라 다 닝고디 셸라데 곰바나데 삼발라 다 디나로리야 달리나로 소라 쇼슈로도 하나 저거 쳐야지도 다 소라데 계세 뇽스나소나 달리데 처로 마치지 강에 쉬워져서 근데 공부나 손데도 대송자야다 소 셸라게 토네 인데 직 연구를 사례게 nen가르샤 다 단다 냠시 제제야 베메 토네 냠시 나제 안다 드레기 나자리아 텐덴디 디스 팽도 라드네 게 메세케 안다 하고마손 티콜네 셰마손 지단데 냠시 나다 나 심바레라
So Dr. Gyaltsen further stressed on some of the dietary measures, especially he recounted his experience when he went to India, especially in some of the monasteries, that when eating dal and other things, sometimes they mix soda, and others when they're eating them. So sometimes those things aggravate the digestive properties or make it worse. So those are some of the things. And then in relation to research, it seems right now Tibetan medicine hasn't yet conducted a clinical trial or a research on whether its medicines are benefiting the disease of POA or H. pylori infection. I think that is the state of things as yet. But from my personal perspective, I think it is important that also in addition to what the panel members said, I think it is very important to have a calm mind. I think it is also very important to have, relax, because when somebody is stressed out, then there is some evidence that stress may lead to aggravation of ulcers and gastric problems. So in Tibetan communities, in Tibetan population, we are all very susceptible population. We move from place to place. People come from Tibet to India. People move from India to West, then in search of papers and things. There is a number of, in this continuity, there is a number of areas where somebody could be really stressed and depressed. But drawing strength from Tibetan Buddhism and drawing strength from some of the concepts laid out in Buddhism to keep oneself happy, Tibetans have really worked hard to stay as a community and worked hard to keep oneself happy and not let oneself depressed. So in relation to this disease also, stomach cancer is one of the most common cancers that is a cause of death in the Tibetan population. Nowadays, the death from liver cancer due to hepatitis B is going down. And then the death from stomach cancer and these GI cancers, they seem to be staying up. So there are a number of these things that we need to take care of. Eat good diet, and then if there is symptoms, then go to a doctor. There are a number of tests that are mentioned, like H. pylori. These has to be tested, and there are medicines. And Dr. Estila mentioned that sometimes one may not get better right away, probably because the bug is resistant to those drugs. So there may be some other cocktail of antibiotics that may be helpful in those circumstances. So it is really important to stay on top of your disease, stay well informed, stay happy, stay relaxed, and then take this forward. That's just my message. And then Dr. Namdul has something to add on that.
I want to make sure we have time. Like, I'll just add to what Dr. Liu's questioned about the any kind of research being done in Tibetan medicine, and really what Dr. Kesala talked about, how actually Tibetan medicine looks at the issue related with the gastritis issue or H. pylori issue. Tandang yegi kondo tanda koranzo Tibet galngi ropsi nimbe shugo samso. Ngai dumji kinazo nyamdo saying deba chunso. I want to share a story. So by the end of last semester, I was down at Emory, and we always have, every 2 years, we would have 6 months from Tibetan settlements down from South India as His Holiness the Dalai Lama scholars. And one of the monks who happened to be there, he was from Mongolia. And I don't know if Dr. Liu, you know him. I forgot his name, but he actually originates from Mongolia. And his mom came over for the convocation, for the graduation ceremony. So when we were all sitting together after that ceremony, that monk from Mongolia told his mom that, oh, we have this Tibetan Namji, and he told me that she was really interested about Tibetan medicine, and she really wanted to know more about what's going on back in exile in India. So she came to me, she was like, oh, I really want to talk about this interesting thing that happened back in Mongolia. And she was like, do you know anything about H. pylori? And I was like, well, I mean, that's one of the hot topics in not only among Tibetans, but basically within the research faculty members, physicians, people who are actually working there in India and in Southeast Asia. So she was like, she spoke to a doctor who actually was doing some kind of a study, which is not really a well-designed systematic research study, but he was just kind of doing a trial and error study in his lab. And he was receiving lots of Mongolian patients with H. pylori positive. So what he did was he was trying to see, I'm sure most of us here, and especially people here on DICE would know about this, that H. pylori bacteria, they thrive in acidic environment, right? And most of us Tibetans and also in India, we love consuming any of this acidic food, whether it's a fermented, spicy, we relish on those diets, right? So in that sense, if any one of us are infected with H. pylori bacteria, we're just creating a heaven for them. Now the thing is, what the doctor did was he wanted to look at some of this Tibetan medicine which actually counteract that environment, which actually counteract that acidic kind of climate that they create in our tummy. So he looked at this particular, I don't know if Dr. Amjigesna you have heard about it, but he looked at Zhongxi Tukpa. And Zhongxi Tukpa basically, do you remember what we call Zhongxi in English? I forgot. Lime. Oh, okay, that's great. So there's a particular, it's one of those particular minerals or a stone which has more mineral content, limestone. And limestone, basically, he got some information and he tried to do some study and realized it is producing lots of alkaline-based chemical. And what it actually can do is it can just counteract that same environment that's very, very thriving environment for the H. pylori bacteria. So he started giving Zhongxi Tukpa to a bunch of his patients, and they saw very positive results. He saw really positive results. So that woman who came from Mongolia was really excited to tell me, like, you guys should do something, or maybe some of you should come to our place and do some study on this. And I think this is something which I've been also telling not only some of my colleagues, but also some of the Tibetans that I've been seeing last few months, that if someone have this, and I think in some sense I'm repeating this, if someone has either gone to see doctor and have this diagnosed, or if someone haven't, please do so, because it makes things so much more easier to have certain course of antibiotic, and then maybe kind of complement that with the Tibetan medicines. And that could really be kind of a win-win situation, both for the physicians and the patients too, because it makes things so much more, I won't say easier, but simpler, right?
Mm-hmm.
Yeah.
Dor namla shugo de lamsan ji gyuwa ina tanda Mongolia liya kurang ke nyamyo tanda newa ji te dewa kapsu tedi zimba Mongolia ke newa mambuji pepe amji ji liya tuwa yungu yusare an de tuwa yungdu kurang zo ta poa ke kange mambuji tegi mero an de kapsu ani kurang ke me tanda tongshi tuwa di tangdu zimba de ke 지게 펜도 슈심부 연구유에 다진지 텐데 중에서다 디단 대체 단단한서 지조 나로리에다 페메게다 디기야 펜기 도움도 좀 십차고 주진 염시 지야다 텐데게 고갑직 텐데지 요서레스제 또 남들라기 수에 조 된다디 디레샤 디네한서 do we have time for discussion for panel? We ran out of time and we would like to open this discussion to the floor. Nima nambane tiwa yuna.
Dr. Number Zone. Not Pemen call and the toy call Sung Songa. Tangarang Yamung China sent to Tana the Poly Temple showed you about the Tonsa Kanlas Nanga Jagadi. Not Kani Chukumo to Pot Tapana de Shindo Dabodina. Kushu about Chunchu says on a Lasam never how to do. Daily Mexican Pajin sent to Tana the Pajin Tambo so Kadu in Gilly. Mexican Chalena Tamali Jaja Shokta Redena, Tessani Shivoji Pants. Then he moved in the Pajan Logic Niji say, sing up. That they lost some Jews chance of the chicken numbers of fire. They said the point that the Central Tana the Lungdi Pagansum, there's a Kangi Chole, Pajin, demand the Kangil Penguin. Something here, Gaboni with the partner you do, say, not to the cancel and not this and a degree. That in I am Lungdi Pagansum, some the Eva Chedu. The Central Tana demanded for Kangil Penguin at it. The Pempo Yavajing at Jajai, Telekalin, I don't know.
Tanda Palasona Shire, Tanda Parul Pagapilia, Poa Kangi Chondevache, and Central Tane Kanzam Stanza of Sugar, and Poen Nadade, Sundato Sona Shire. Tanda ta naza tangbo gozu yundu sambala yamanangongo chela ta peme de yago shu shure chingi chung ta maomba ya de the cancer de cha cha shugoli ya ta bed singda cha de halam khago cha de re de nani ya tanda ta sindu thane de dinalo me zo de ya ta me mango chur dinana zo de karasna sindu thana nga pomegranate la shingdo jora la de lu sha re ta Teach Sambala Palagi Poa Nalolia Pejin Pegin da Yemana Lungi Kenchi Poa Puya, the Safia Jaya, Tendejita, Cap to Sambala Palala, Tasumena Amji Suina, Sambala Tsang, Yabadu Sere. Ta Sidi Sambala Pala Ken Peshana, Narangi Subashana, Lunda, Pegingi Kenchi, Poa Ginesh Yonde Gire. This was a Yasu Tani Tandu Sambala Tada Horanchia, Naza Singda Doche, Pen and Shonde Gore. Ta kese ya pala la poa nazakange de chongson sentro thane ki chacha tam phen ta da singda drer de tegi neba shimba kange chego ji poa nazachile ya ta chego ji sana ga neda de yenge chapsha ja la su ja la chile ya sentro thane tane singda thagre la na ya di shu kha go shore khai sana nganje gi ta meso so ga shin kha kha ga chego re long theba pegen la ne ta chilu ba da pheme gi parulia mandra kharer sana chilu pala ta pala song na poa de su ja go chu sabu khasa Chuzen Jogodus La Chuta Tango Sayad, Safia de Jar Chuchumut in Chuguna, and that antecedent Tanguna, the Kandarchigia, Safia Makai, the main Tagaran, Tachion Chader, never chick Naguna Tagaran Tanger, never chew Naguna Tagaran Tanger, Tapemela, that Taje Chia, the So Jucaredo, Longoredo, Chebaredo, Pegendo, Kesi Cheban Gain Chiji, Palalia, Safia Jala, the Nella Soma Machina, that's Sindu Tanegi, Jadama Pengiris Lanaya, this Shukabora, this was Zaya. Kesi naza yosuna ya tache ke soso ke yendo keje tiche jugen karedo longda tiba pegen kargi chado dinani ya soso ke peshashina longi kenche je ya suja ya ngachina kare yungursana ya ta doala se yangla tsubala disambala coffee sora dana yorala ta doala ta coffee tuya ki lusu shuish doala coffee che cola che ani chagwa re de mangu shuish peje tangi doala ta coffee da cola da chagwa anzo kare che korsana ko tangmo ki rangshin chagore coffee di tsubu shujore this December long shoes ya pen or so ya. The long gets any the pen December cargo or son and poor burn or so any chicken semper matching to Chagdola. The gate the cane cardo, that chicken Chagbala so what the map, Zem Gache, Yamdo ya Peme Tansonia, Pembushores. That's all kinds of palasonia, Domdo Jasonaya. Na me chigi ya neba chigi pengi na me digi ya naza chazan la pengi res la ne shu kabo res shu ya ta zoda sosori ya lung tri pegen la me sosogi rangshin karo do dile pawi ya me tango res shu ya.
Tanda amju kunju like so na shi re ni gela tanda tiwa na gyu ni robs di shu sam so jidan lela shu ji khari yor shu re jina men di gi gyupcha di khari me jero ala sendu le na du sendu di ngara jo singdo ju yo ala pomegranate la ni ta ine ge singdo di nga jo men na pheju ji de di ngara jo gi thom la yobe ge singdo di thara ma re la ko ya de singdo di nam gyu singna rangal ge chi ko roge no ba da khu gi nuba di shukche ta ine sendu gi nam gyu gi ta ngara jo phime di khala na shukche charani le yawa shayor 차와다 창와들어 마 도르도 윤디 잠바 아니 메 가리 가지고 자 윤디 잠발레 로투가라 시샤기요레 응아리 큐르 렌자 카와 차와 까발라니 로알라 손자디 윤디 잠발라 신주디 조역이랑시레 신주디 가디네 조역이랑시레 코이기 누버디게 조역 누버땡이요로 손자디 윤디 게라 당이 소원하시레 신주 당내디 윤디 잠발라 조치 코이기 님부디 땡인도 잠바다 시워디 좀에서도 저 땡어라 아니 나라죠 포웨기 메트 신차지 포웨기 메트 냠치 다 디디야 러소 체체도 는 아주 신도 당내 땅이고요 다 디나시레 디인도 잠발라 나라죠 메야 신다야 하시요레 포웨기 메 레데니 메 시부요라 디야 가스나 아주 포웨 나라 큐르기랑시다 포웨기 드제디 갑고데올라 체네 학바 게체 손자 디인도 잠야 마야 코 트레드 마짜오라 so the mission that the send to Tane the pig to che tangi am la so na shi pegin gi shi ma ji la lung gi dong che ani ne shi yong de wa ta the ji dang ju gi po la ni chogo changma di gi changil go na de ding ju gi chawe gi changwe gi ngol sha gi ro la sham di da thui ngol sha gi ani pegin na ya kyu da ti ba na ma shi me sha gi ro so the dang sik chu ju na shu ni ni na shu wa na ko thui gi na shi na che pegin la ko 팽이 디 university 연결 센루드럴
I'm wondering if the panel can help me with a panel consensus. The context in which I'm asking for this is one in which the community is resource poor. It's a nomadic community in Kham. And the question is, we also have a high incidence of this, these gastric complaints. We have maybe 50 or 100 people lined up ready to come into clinic. They can't come in more than once, maybe twice in a year, so we don't have the opportunity to follow them up. We have no endoscopic procedures. We may have access to antibiotics and we may have access to Tibetan medicine. So in this context, is there a consensus in terms of do you go ahead and treat with antibiotics from the start, in addition to some kind of Tibetan medicine and diet recommendations? Do you start with Tums, lime, calcium carbonate? Or how is there a consensus as to how to work in this particular environment where we don't have the resource to access medical care except maybe, depending upon the weather, twice per year? Antibiotics, Tibetan medicine, Tums.
I'm so sorry, if you don't mind, could you repeat your question a little bit if you're directing toward the Tibetan doctors here, because since you have your mic closer to your mouth, it has been bouncing, so I didn't really hear everything. If you don't mind, could you please?
So the question is, could I ask for the panel's help in developing a consensus as to how to approach a particular clinical problem where the community does not have access to medical care except depending upon weather and their movements, maybe twice a year. And so following them up, getting diagnostic procedures for gastric complaints is not possible. So I'm asking, is there a consensus? Do you have three modalities? Do you use cheap things like Tums, antibiotic and Tibetan medicine from the very start for the whole community, because gastric cancer is such a high prevalence disease in the community?
I think,
I think Dr. Don raised a very important point based on his personal experience of traveling to Tibet and witnessing some of the real-life conditions out there. Many Tibetans have presented to Dr. Don's clinic, and they are going to come for only one time. They do not have that resources and that opportunity to come twice. And then Dr. Don's question to the panel was, what would be the consensus as to how we go about treating these patients who presented with POA? Do we start them, number one, on antibiotics? Do we start, number two, on Tibetan medicine? Or do we take another approach, or do we take a collective approach? I know it is a very challenging but a very important question. What do the panel think about this?
So I'll give you my perspective. I understand the remoteness of the area, lack of access to other care. But I'm of the view, if you do not have a definite diagnosis of H. pylori, I would not use antibiotics. That's where I would usually stand, because it's not a benign thing. First thing is do no harm. And from that aspect, you're giving antibiotics, so there's the cost to the unintended, side effects from the antibiotic, and then, follow up whether they got cured or not. And so I think it puts up a lot more things. If you can make a diagnosis, then I think you should treat it. But do no harm, I think, is how you should operate. So I think you should start with more benign.
I'm sure all of us here on the panel have something to say, because we all have worked, even Dr. Liu, you have worked down in South India for quite a while, haven't you? And especially at the monastic community. But I think ideally, if you have the kind of a constant interaction and dialogue between the Western biomedical practitioner and Tibetan medicine practitioner, I think that could be ideal situation where actually you have that constant interaction. When I was in Dharamshala, Dr. Kunchok was there too, and there were a few other doctors too, and we always had this interaction, and it was really, really helpful. And I can expect the same thing happening when Dr. Thupten was practicing down there in South India, and same goes with other doctors here. Sharing my own personal experience, when I was at Menzika in Dharamshala, we used to have, was that every second Thursday, Dr. Kunchula? Was that every second Thursday? So every second Thursday we would have a kind of a grand round interactive session between the Delek Hospital's doctor and some of the Menzikan doctors. I mean, especially the Menzikan doctors from clinics would go up and we would have the interaction. And it really works so well because, as Dr. Estila mentioned before, one thing is really to do with how confidently you are able to make diagnosis. And in the Western biomedicine, basically the margin of error, as far as my very little experience, could be much lower than someone with a Tibetan doctor and going and say, oh, you have this particular stomach or POA illnesses, and I want to treat with this particular regimen. And even though if I have a certain level of suspicious, I would really like to, dial a number of Dr. Kunchok and ask him, could you please look at this patient and run certain tests? And I think that would really help. And if there's particular diagnosis that might warrant any particular treatment, like for example, for H. pylori positive, I would really say that starting with the antibiotic works so much better as far as my personal experience is concerned, and then follow that up with certain other Tibetan medicine, basically really to help to revive the digestive system or any specific area in the digestive system that I want to focus on, and then focus on diet and lifestyle changes. And I think in that sense it really works well. But sometimes that ideal situation doesn't persist everywhere, doesn't prevail everywhere, right? So you need to have that kind of a partnership, I think.
Since this is an important question, let me take this. And I think to give you my perspective on this, I think it may also depend upon the type of patient that you are seeing. If it is a patient who had actually received Tibetan medicine and has really benefited, then from my experience, I saw that number of times Tibetan medicine works very well for these diseases, but number of times it doesn't. So I think it is also very important to assess and to ask some questions as to whether these have benefited or not. And if it is a patient who's having severe symptoms, having really problems and not able to come again, then I would probably think that H2 blocker or a proton pump inhibitor could be safely prescribed. I'm wondering if, and then we may not have to straight away jump to H. pylori therapy, but many a times just PPI, they work. So I think, you know, it is really challenging when in a resource constrained setting. I think it is, you know, we need to look at what are the amenities that are available and how best we can make use of the existing conditions out there to deliver the best. Now let me, let's move on to the next speaker. So I will request Dr. Fuerstman to make his presentation.
Thank you very much. It's a pleasure to be here again. And I was been asked to talk about asthma. Asthma is a very interesting disease. There'll be a couple slides coming up. But it's an interesting disease because it is a chronic disease of the lungs, and it's a disease that starts with inflammation or irritation of the airways. Next slide. So this shows what the lungs look like on the inside, and in particular what the airways look like. It starts with the large airway coming down from the throat, the trachea, and then it divides into smaller and smaller airways as it gets out into the lungs to and the air has to pass through those airways to get to the smaller airways where the actual work of the lungs takes place, where the oxygen from the air gets into the blood and the carbon dioxide is removed from the blood and removed from the body. Next slide. So what happens in asthma is that there's an inflamed airways that occur, and Dr. Estela was fortunately has already explained a little bit about the immune system in fighting infection, and the inflammation is one of the main ways that the immune system fights infection, which is obviously a good thing. But the interesting thing is that sometimes the immune system becomes too active, becomes overactive, and instead of just fighting infection, it fights other things in the body that cause harm. And actually, if you look at history over the last 100 years, 100 years ago, both in America and around the world, the majority of people died due to infections. With the advances over the last 100 years in sanitation, in antibiotics and vaccinations, fewer people are dying of infections. Particularly in America, the vast majority of people die of other chronic diseases that actually have to do with the immune system attacking the body. Things like heart disease and diabetes are largely caused by the immune system attacking our own blood vessels, our pancreas, where the that produces diabetes. So definitely in America and more in the rest of the world, you have a situation where these chronic diseases of inflammation are becoming greater and greater problems while infection is more brought under control. So in particular, in the lungs, you'll see the inflammation is a process that causes a lot of swelling as the immune system moves into that part of the body to fight whatever there. In this case, you can get swelling. On the left side here is what the small airways and the end of the airways in the lungs look like, and on the right is what happens when there's an asthma episode, an asthma attack, and the lining to the airways becomes swollen so that the air can't move in and out as well. There's mucus that's produced in the lining of the airways that fills up the airways. And there's also muscles that are normally around the airways that help to regulate the amount of air. And those get irritated so that they clamp down, they go into spasm, and that also makes the airway narrower. So all of those things make it much harder for the air to get in and out and cause the wheezing and the shortness of breath that's part of an asthma attack. See, I'm going to continue over here because it's more comfortable. So in terms of how do we know somebody has asthma, how do we diagnose asthma? The pattern is usually that there'll be episodes on and off of wheezing. You can hear wheezing sounds. The person will be short of breath, hard to catch their breath. Often there's coughing, especially at night, that may wake the patient up at night. And sometimes there's also anxiety that goes along with not being able to breathe as well, and also makes the asthma worse as well. The other thing that's important about diagnosing asthma is that there are tests that can be done. There's called pulmonary function tests that test how well the air is moving out of the lungs. And they're small machines, they're big machines, but all of them have to do with the patient blowing into a tube as hard as they can, and then the machine measures how fast the air is able to move through the tube out of the lungs. So the worse amount of asthma you have, the slower that the air will be able to move through the machine, and that measures how severe the asthma is. And the other thing that's really important about asthma is that there are different things that can set off asthma attacks, and it can be different things will sometimes, in any one patient, it'll be one thing or two things might cause it. In another patient, it may be another one or two things that will cause it. So it's important to identify what's causing it in a given patient. Some of the common things that can cause it are viral infections or colds, things that are in the air that are inhaled, things that the patient is allergic to that can set it off. Sometimes it's the temperature of the air when there's a change in weather, when it first becomes colder or hotter, that may set it off. And for some patients, exercise, when they start to do more vigorous exercise or sporting activities, it will set off the asthma. And this is important in terms of how do we treat asthma. And so one of the important things to do, one of the things is going to be medication, but the other thing that's really important is to to try to identify what's triggering the asthma attacks and to try to remove that influence of what's triggering it. So in patients that are allergic, you might need to test to see what they're allergic to. It might be things like mold or dust mites that live in dust, maybe animal hairs. So it's important to identify that and to adjust the environment to avoid those. Same thing with things that may be in the air. Smoke is a big thing, from either smoking cigarettes or being around people in the household that are smoking cigarettes. There are other things, air pollution and cleaning products that can also trigger it. We talked about viral infections, so we were talking about vaccinations. Getting a flu vaccine is very important for anyone who has a tendency toward asthma. And we also mentioned a little bit about stress, so avoiding stress is equally important. When it comes to medication, there are several main types of medication. There are what are called bronchodilators. They make that muscle around the airways that we talked about that tends to go into spasm. It makes those muscles relax. So these are given are inhaled either through a little handheld inhaler or a larger machine nebulizer that produces a mist to inhale. The next type of treatment are steroids, a type of medicine that can either be inhaled or given by mouth or injection. And then there are some other medications that interrupt the path from a trigger causing an asthma attack. The most common one being is called Singulair. So and it's important with treatment to adjust the treatment according to determine how severe the asthma attacks are, how frequent they are, and to adjust the medicine accordingly because you want enough to control it, but you don't want more medicine than you need in terms of avoiding side effects. And there's we talked a little bit about stress and the importance of a calm mind. Well, there actually have been other treatments that are aimed at using relaxation and that have found some good success. There are biofeedback machines that help to train the mind, and one of the especially interesting ones is that there's actually a study for asthma in children that shows if the parents give a short 5 to 10 minute just relaxation massage to the child before bedtime every night, that the severity and the frequency of the asthma attacks is greatly reduced.
Thank you very much, Dr. Fuerstman. That Dorlage Sunjo the Nye Pyogen ya Dorjee ma Gyurgi. The Dorlage Dr. Fuerstman ge Swain the asthma nazo di kolare. The asthma nazo di Kranges labdu Kandes Chungu Yores labdu sama di tanda ganjo lung dolam yorwa. Lung dolam del ya nyingata lowa da lung dolam ge pasan doal ya nyingata waina an di kenche an de samda den lanche an di ge ani asthma nazo di na yungdo. Chesa di kien suruji asthma nazo naya di di lung dolam jorwa del ya nyingata di cheje resha. Dine asthma nazo di takjen karre di nazo di ganjo kandes ngota chutu res labdu tangbo di ho ushu sa yungdo. U yangsen se sa yache ani mixe ge u sa du zimba weis legwa city suruji kyabche u tangdan sir se u tangdo. Di chik resha, and dine chen liya lo shuk shumbu gyabayada, and chen liya lo gyabdu zamba ni bet se wu tuwe dinde ge nedan chi cha sikdu. Chesan di tsama ani pangwo dam deyada, din tsama asma nayandu di ge takzen resha. Ani ya mambuji asma naza yewe kang liya, ya nelo gyabyungudwa, naza duru dhudwa zamba ya takzen mambuji da rang gani ya le yungudu. Tenda di gang liya, tenda asma naza di tako kendi karjini yungu yores, nazo di kandes yungu yores labdi, ta misege nazo tangbo kandes chungu yores labdi di pe kago resha, di gyumze ken mangbuche resha, ta misege nazo di asma nazo di yuwa ina, ani dele ya gone tsamsam yangsen attack chi le yungudwa, di le goya ki gyumze ka khashe jidu, di gyumze tangbo di peshana infection jamanda, viral infection soro, dinde yung sikdu, niwa di tsamsam yang subo ki charangda, chilo ki 차와다 차랑주 야부지 템퍼레처 데이터가 대마데 딘데게 야 차랑다가 뇨마뇽 체제 야나 아스마나서 데텍트네 요마시오 마르샤 야 숨바디 탄다 알러진 데 요라 펑거스다 몰다 먼저든다 딘데 이무도 샤젠다 딘데 슈크심부 요나 디게 야 우나리아 두드즈마 디게 코 따다지 tumor do chi yang lamsa attack le da dinde ji cha de do an dine zo de da zo an ya sam stress shuk shim bu dinde kia da yang sam ko luze shuk shim bu ze exercise shuk shim bu ze dinde che wa ina an di ya asthma gi na zo attack zo yang se le yong ji le sha the asthma na zo de li ya yang ngun go da ko min jue da dinde do de min jue da ma bu ji ting sa me tian de ma bu jo re tian khra ya na kha ma da kha kha shi ji do an di nyam do tan min jue da de je 겐디 민주 차도 여러 겐 오트에 저와 기시 샤젠다 딘데게 아스마 용구 요와다 야 소수 소볼이야 사야다 딘데 담다 딘데 마트에 디 용구이나 디 커리 임바디 모타 추잔 디 고네 마체 저와 디 계신 부르샤 믹세게 아니야 삼삼 exercise struktur 슈든데 제제 아스마디 용구 요와이나 야 코칸데스 제고고도 겐디 모타 추제 딜라바베 민주 제디 콘네가 전부 저래샤 또 조디도 Fuerstman 크랑게 송에디 So I briefly translated what you have talked about, and I would like to open it by asking Dr. Fuerstman, what advice do you have to a parent of a child who's having asthma?
I think the important thing is actually to pursue all avenues. So is to get a complete evaluation. So, because if you're lucky enough, you can find a few things that the child may be allergic to, or things that are triggering it, and you can, alter the environment by like putting covers on the bed and avoiding carpets, that keep dust, or you can do things that can prevent the attacks. So that's the best thing if you can do that. And if not, it's important to have good monitoring so that you use just enough medicine, but not too much medicine to keep things under control. And then by all avenues, I think things that affect the mind, things that increase the relaxation, things like that study that showed the bedtime massage are important as well.
로게 송야디 내가 조데 데리스 직 당보 개치슈디 보델리아 아스마 용고야기 겐디 카르샤 디 하고야디 개준 부레샤스 디 겐디 하고와이나 안디네 겐 라바베 당기 슈나 단다라 난기 녜제도지 마이나 디 주었다고도 도움도 아니야 믹세게 야 탈라 마불라야게 딘데기 시서든데 요와이나 야 두조 메어스야 야뭐고 딘데 디 지그레샤 안디네 냠도 보기 메주즈 카르카르 치기메 프랑기 나제기 고 당제니 전에 프랑기 나제 용단니 전에 민주니 전에 디상마 야고치진 고 최야디 베케준 부레스 이제 디지 송도 안디네 냠도 탄다 프랑기 다 민주다 디상마 가야 안 믹세게 탄데 신다지 프랑 가르 송도 슬랍디 망부지 탄다 스트레스 다 excitement 다 딘데 슈크shum부 충바이나 야고 asthma 용구레스 믹세게 탄다 야 셈데다 딘데 슈크shum부 딘데게 야 attack 딘데 요마시오 마샤 제선 셈발 흘려치야 relax chia dunzo pe kechin pores chesan dige sembal hulu chia da tab nangmi ge phame ge ngeni shu ge ba jorwa dunzo nenga chim poresha an dine shinda chikta chidang ge yongda ra re dunzo tangsen pool ya tangsen dine yungu yo ba ne ya nangli ya dunzo phama zu nim do menju da du sama yo ba re an dunzo peju tang dang zu khandes tang gu yo me da di sama chidang kechin bu shu cha de yo re an mikse ge yan zara dine chungba na namsa khoan do so do dunzo changma ngeni phame ge shin ya de kechin bu shu re sha Dr. Namdul,
thanks for a very concise presentation or talk. I have a question regarding, just following up on what Dr. Kunchok asked you, a question regarding asthma in children. Quite frequently I've seen children when they have any kind of asthma or breathing issue, it seems to be accompanied by a severe skin problem. And I'm wondering, what's its trajectory? Like, how does it progress as child grows up? And it's quite frequent in Tibetan children.
Yeah, there is an association with a skin rash called eczema, and also with some seasonal allergies, the hay fever, environmental allergies that tend to be associated with each other. Asthma is interesting because there's the trajectory is variable. It seems that if a child has asthma, that about a third of them will just have only a very short period of where they have the asthma and outgrow it fairly quickly. About another third of them will outgrow it, but a little bit later on, maybe in teenage or in the 20s, they'll gradually outgrow it. And then about another third will continue to have it off and on throughout life.
Namdul tiwa di mabuji ngazo asthma newa nyamdo yang pakpege nazo dimbe nyamdo yongde dus. Chizan di kurangi taba re songdo ngazo ko mixe tanda allergy dinde yorwa. Dinde nyamdo pakne ralan digmundo ta allergy ran shadi yore. Eczema zayudwa. Di yang asthma da kuranzo nazo nyamdo dewa yuzama. Zo yangse yangse chik yongay di kuran nazege rangshi rares. An mabuji tanda tiwa niwa di keshin kuresha. Ko lo ya ledu sama asthma nazo di chadu mares. Di khande yores. Da kurangi sumbayna Mambujilia, Kurang Halakal pet hardware yores. Mambujilia, low Kashish Mune, Tangi, the new Runga in the dos. Mea Rangajilia, who music hansa toast, ya or Kodi, Naza de Kangi Teche, dos, Dedi, dos, teachers and ko the Yuruadoji, the Loa, Misus, Hansa Yapawe, ko Naza de Chunda, the Churim Sorojo, Dodan to Rim Soros, the Loa Jinsare. Dora Estila.
단지 슈에디나 체변 단데 고비하고 좀 단다 아스마 걸 손제 저 루게 손스 단다 아스마디 용체도 같이 바이러스기 네부디기 치고요레스 디나 믹스에 따단다 야가스 차세 칼리가제 공가제 리그와 디 플루 시즌 데 리그와 다선자 단다 플루 vaccination 제제 디 인지미지 겨울 소인데 디 백해신 부레 단다 아스마 시범으로 아스마 메네 인지미지 경고그레스 제쇼인디 지다 소소라 나자 마야오치도 찍르와야 나자 야 플루 백신 디 갭체 나자 용마레 시고 말다야 나자 용바이네 나자 야 두자 디스 칼라고레 슈크추와 나야기 찍체 딜레 케셰딩이 카르통우츠나 수수님도 공루겜바 볼로 몰라서 유베네레 야메나 미 부춘준데 유베네레 디겔레 야직 송겹기 소라지 체제 삼나당체 the intimate swing. And ya Kolo depth again, intimate guns. Kalana, the tone to the manche the Kolo gamble of flu nache, flu gang, Neton manche Kolo gambache. Ania, the ne poo union, toll poo horde, the game benia, Konzo flu the intimate gun showing the Lodara spion war, Toshina.
That's a very important point that Dr. Asti raised about the importance of giving flu vaccination to asthma kids and even those who do not have asthma, normal people, especially elderly, because they are more susceptible to adverse outcomes from flu. And also, Dr. Asti raised a very important point about herd immunity. So basically, if you have flu and if you get the disease and if there is an elderly in your home, if the elderly gets the disease from you, that's a big problem. So if you get it's not exactly herd immunity, but it's around a similar concept. But if you are vaccinated, basically you are also trying to prevent your elderly colleague from getting the disease from you. So it is really important, this concept, and then also pregnant women. In your home, if a woman is pregnant and then if someone partner is having flu, then the other person may also get the disease. So around this, so it is really important to get the vaccine for everyone. That's Dr. Asti's focus. Thank you.